If you are a medical coder and want to pass the CCS exam from AHIMA, or if you are an outpatient coder and willing to learn inpatient coding concepts, then this video is for you. Hello and welcome to Learn Right. I'm Vinay Kumar. I'm a trainer with over 2 decades of experience in the US healthcare industry. I have trained more than 1,000 coding professionals to learn and get certified in medical coding. Let's understand what the CCS certification is all about. Where do they test you? Which areas and what you need to learn exactly. CCS is one of the best certification programs in the medical coding industry and has proven to be the next step in their career for many coders. With this certification program, you can learn coding concepts related to both inpatient and outpatient services rendered to patients in a hospital setting. And you will also need to master the guidelines and coding concepts related to ICD-10-CM, ICD-10-PCS, and also the CPT to be a CCS certified professional. This is one of the important requirements for a CCS professional, specifically the ICD-10-PCS. Now about the disclaimers. So CCS is a registered trademark of AHIMA. CPT is a registered trademark of the American Medical Association. ICD-10-CM codes were developed and are maintained by the National Center for Health Statistics under the CDC. ICD-10-PCS codes were developed and maintained by the CMS. Now let's learn more about the content of the exam. All the questions in the exam are related to these 4 domains of the HIIM. Coding knowledge and skills, which makes up 51% or 51.9% of the exam. Coding documentation, which makes up 10.1%. Provider queries, which is 8.9%. And regulatory compliance, 29.1%. So these are the 4 domains from which you'll be presented. The questions will be presented for your exam. Now let's take a look at each of these domains individually. So the first domain, coding knowledge and skills, 51.9%. Apply diagnosis and procedure codes based on providers' documentation in the health record. So obviously it's all about diagnostic and procedural coding, which means you'll need to know the ICD-10-CM, the ICD-10-PCS, and also the CPT. Determine principal or primary diagnosis and procedure. Now here you will need to understand principal diagnosis specifically. So there's a difference between inpatient and outpatient coding. In the inpatient, we call it as principal diagnosis. In the outpatient, we call it as the first listed diagnosis. There's a lot of difference between these two, which we'll know as we keep learning the inpatient concepts. Okay, and you also need to understand and apply the coding conventions, guidelines, and regulatory guidances relevant to the inpatient and outpatient aspects. Of course, you'll need to know the CPT coding system. You need to know how to code from the CPT coding manual, and you'll also need to understand what modifiers are and how to apply them. Then sequencing, diagnosis, and procedures, which most of us all know what sequencing means, right? Specifically in ICD-10-CM, you will need to know which diagnosis comes first, which diagnosis comes next, depending on different guidelines and situations and scenarios. Then apply present on admission guidelines. So this is something specifically related to the inpatient coding system, where you need to identify every diagnostic condition, whether it was present at the time of admission or not. There is something more specific related to the POA indicators, which tells the insurances or the government whether a condition was present when the patient was admitted to the hospital or not, which is very much important to understand to identify different scenarios like hospital-acquired conditions, for example. So that's about POA indicators. We'll learn more about all these things going forward. Then we will also need to know what coding edits are. We have different types of coding edits. For example, like we have the NCCI edits, National Correct Coding Initiatives, right? So you'll need to know the different types of coding edits. Then you also need to understand the different types of reimbursement methodologies or classifications. You'll need to know how to abstract pertinent data from the health record, like you'll need to know what needs to be coded, what should not be coded from the medical records. Then you also need to understand and recognize what major conditions and comorbidities are, and the comorbidity and conditions, which means CC and MCCs, as we call it in the inpatient setting. Now, this is 51.9% of your entire examination, made up of coding completely. Now, let's understand the next domain. Domain 2. Coding documentation, which is 10.1%. Review health record to assign diagnosis and procedure codes for an encounter. Review and address health record discrepancies. So you'll need to understand whether there are any discrepancies in any medical record. Sometimes the procedures or operative reports, for example, the pre-op and post-operative diagnosis may say the procedure or the condition is on the left-hand side. Okay, when you go into the description of the report or the body of the report, somewhere it might say it is on the right side. So there's a clear discrepancy between the left and right, right? This is just an example. So there are many different things which you'll need to understand when you are reviewing a record. So this is domain 2, 10.1%. Domain 3, provider queries, which makes up 8.9% of the entire examination. Now, provider queries are mostly seen in the inpatient setting. We do not see them frequently in the outpatient setting. What do you mean by provider queries? Like sometimes there are certain clinical indicators which are presented in the medical record, but a specific diagnosis is not established or written somewhere related to those. A classic example is sepsis for the most part. If you say fever, tachycardia, leukocytosis, and a couple of other clinical indicators related to sepsis, which are all documented in the health record, but then provider has not stated sepsis or any sepsis related condition anywhere in the document. In such instances, as a coder, you're not supposed to code based on clinical indicators or clinical data. For you, the rule is if it is documented, you need to code it. If it is not documented or confirmed, you may need to ask the provider before coding, right? That asking is nothing but provider query. Now there is a certain format which you'll need to follow when you're asking a provider. Like there are two things, like one is a leading query and the other one is a non-leading query. Okay, so there are different formats and different types of queries which you'll need to understand. So this is the third domain where you'll be tested. Physician queries. The fourth domain, regulatory compliance. To put it in simple terms, everyone understands what HIPAA means, right? What PHI is. So these kinds of aspects are all covered under domain 4. You also need to know certain payer specific guidelines. You need to know what patient safety indicators are, what hospital acquired conditions are based on the documentations. Of course, HIPAA guidelines, as we were talking about. Then you need to know the AHIMA's standards of ethical coding. And also you need to know the Uniform Hospital Discharge Dataset, UHDDS, what it means and how does it apply. So these are the 4 domains which you will need to understand and learn for to prepare for the CCS examination. Now, we will get into more details about what exactly do we need to learn in terms of the preparation for the examination. First, let's understand the pattern of the examination. The exam is a total of 4 hours without any breaks. You can take a break, but the timer would not stop. That's the key. Okay, so 4 hours without a break, and the exam is divided into 2 sections. Section 1 is all about multiple choice questions, and a minimum of 97 questions. Sometimes it goes up to 115 questions. Okay, section 2 is 8 case studies or case scenarios. Now, the first section is pretty straightforward. 1 question, 1 point, or 97 questions, all 97 are multiple choice questions, right? But the section 2, case studies, it's like each case study may have a minimum of 3 questions up to 4 questions. Like first question for each case study would be select the appropriate principal diagnosis. Then the second question would be select the applicable secondary diagnosis or other diagnosis. Then the third question may be like select the principal procedure or any procedures performed. This way, each case study will have a minimum of 3 up to 4 questions for each case study. Now, usually when you are appearing for the examination, you need to balance the time and complete the multiple choice questions at least within 2 hours, so that the next 2 hours is saved for your case studies. But that's for the exam preparation. Let's talk about the content, what we need to prepare and how we need to prepare for the examination. So what do we need to learn for the CCS exam? I was saying there are 4 domains, right? But to be more specific, you will need to learn a lot of hospital inpatient concepts, including the inpatient prospective payment system, the payment methodologies. You'll need to understand what diagnosis related groups are, how do they work towards reimbursement. You need to understand what major comorbidity and complications are, or comorbidity and complications are like MCCs and CCs. You'll need to understand what present on admission indicators are, what hospital acquired conditions are, and you also need to know how to query a physician under different circumstances. This is for the hospital inpatient concepts, all that you need to learn. Now, the hospital outpatient concepts. You need to know the outpatient payment methodologies. You need to understand what ambulatory payment classifications are and payment status indicators are. Okay, now these things cover the CPT coding aspects for hospitals. This is for the hospital outpatient concepts. And apart from the inpatient and outpatient concepts, you also need to understand other HIM related topics like the AHIMA Code of Ethics, the regulatory compliance issues, and of course, physician queries. So these are the 3 most important things that you will need to learn for your examination. Now, apart from this, the actual coding systems, ICD-10-CM, you need to understand the coding manual. You need to understand each and every manual and learn how to use it, because your exam is all about the book, right? You do not carry any software, or you're not allowed to use any other software or any other tools. It's just the coding manuals that you will carry. So you need to understand how to use the ICD-10-CM coding manual. You need to master the conventions and general coding guidelines and also the chapter specific guidelines. Then you need to know the difference between inpatient guidelines and outpatient guidelines for reporting, the diagnostic coding specifically, because there are quite a few differences when it comes to the inpatient coding. For example, you do not code probable, possible, or versus conditions in an outpatient setting. Anything that is in question is not coded in the outpatient setting. But in the inpatient setting, you would go ahead and code all probable and possible conditions as if they existed. Now, if you ask me why, usually a patient who is admitted to a hospital, and if there is a differential diagnosis, when you say differential diagnosis, there could be more than one condition. That is the reason for the patient's hospitalization, right? So the providers treat the patient as if all those conditions existed and then start doing the diagnostic workup and other stuff to rule out these conditions and then narrow it down to a specific problem or a diagnosis. And that's the reason in an inpatient setting, you are supposed to code all possible or probable conditions as well. Now, this is just an example. There are quite a few differences compared to the inpatient and the outpatient guidelines. That is something which you'll need to learn. And of course, I said you need to know what a principal diagnosis is. You also need to understand the definition and the application of the principal diagnosis under different circumstances. You need to also understand how and what to report for the secondary diagnosis and other diagnoses, like do you need to code from the past medical history? Do you need to code any history conditions? Is there any other area that you need to look for when you're coding in the exam? Okay, and last but not the least, the most important is coding clinic updates. Most of the inpatient coders know what coding clinic updates are. Outpatient, yes, to a larger extent, many of them know it, but still there are people who will need to understand what coding clinic updates are and then also learn as part of their preparation for the examination. Now, this is all for the diagnostic coding. What about the procedures? So we have the ICD-10 PCS coding system that you will need to learn. Of course, you need to learn how to use the coding manual. Then you need to understand the code structure and organization of the PCS coding system. And unlike ICD-10 CM and CPT coding, ICD-10 PCS is all about building a code rather than searching for a code. So you need to know the process of how to build a code from the beginning, from the PCS tables. Then you need to understand the different sections of the ICD-10 PCS and also the different route operations, which are the most important aspect of ICD-10 PCS. And of course, you'll need to learn and understand the official coding guidelines. Just like ICD-10 CM, you also have guidelines for ICD-10 PCS. This is for the inpatient procedures. ICD-10 PCS is used only for inpatient procedures. And of course, current procedural terminology. So the first thing is, obviously, you will need to learn how to use the CPT coding manual. Then you need to know the different sections of the CPT, how to look up a code from the CPT coding manual. And specifically, you need to learn different concepts related to each of these sections. From the evaluation and management, you need to learn the surgery section, medicine section, and also understand the modifiers. It's quite extensive, but if you know the basics, if your basics are strong, then it will be easy for you to learn the CPT as well. So this is the third coding system that you will need to learn: ICD-10 CM, ICD-10 PCS, and the CPT. So overall, this is what your exam will test you on: the three coding systems. And apart from that, there are certain other concepts which you will need to learn and master before you appear for the examination. I've listed out a few resources which I've collected from the AHIMA CCS page. I'll give the links in the description of the video as well, guys, so that you can go back and refer to all these reference materials. And remember the code book specifically. From this month onwards, from June onwards, you are supposed to carry the 2021 coding manuals. No 2020 manuals are allowed, which is very obvious. So this is all about the CCS examination. Do a lot of practice, prepare for the examination well, and good luck, guys. Thank you so much. And please subscribe to the channel so that you get updates on all the future videos that I'm going to make related to the CCS examination, and also a lot of videos for the beginners in medical coding. Thank you so much.